This is Steve Zeltzer, today with Judith Anderson, who is with the Airline Flight Attendants Association. She's an industrial hygienist, and she's written a document, and it's called COVID-19 in the Airline Industry, the Good, the Bad, and the Necessary. And it talks about what has been happening in the airline industry, and alongside healthcare workers, airline workers, and flight attendants in particular have faced the brunt of the pandemic and COVID. So welcome to our show, Judith.
Thank you very much, Steve.
So first of all, what is an industrial hygienist?
Industrial hygiene is the practice of recognizing, evaluating, and controlling workplace hazards. And my particular interest and expertise is mostly chemical exposures and air quality issues. So most of my time for the AFA Flight Attendant Union is spent looking at chemical exposures of flight attendants and pilots, actually. There's obviously overlap. And then along came COVID.
And COVID came to this country, and the airlines were forced to shut down. What was the reaction of the airline industry and the government to the pandemic and COVID-19?
I mean, initially in sort of February, March of 2020, when the world seemed to shut down, the federal government, President Trump was in the office, White House, and he was not in favor of introducing any legislation, not in favor of any executive order or promoting any requirements. So the federal government early on took a very hands-off approach to the pandemic, as people will remember. And so the airlines really had to step in and try to figure out a plan to reassure the flying public to come back. I mean, initially, the passenger loads dropped as much as 96%. I think that was April 2020. Thousands and thousands of aircraft were parked in the desert because they weren't being used. I think it was 64% of the world's fleet was parked. And so after 6 months or so, it became clear that this pandemic was sticking around, wasn't going to disappear. The airlines had significant financial troubles, and they wanted to get people back.
And there was a study done, a plan called Runway to Recovery. Why don't you talk about that plan and what it meant to airline workers and flight attendants?
Sure. So early on, I mean, the flight attendants, obviously, everybody else is told to stay home. We all stopped going to school and we started working from home and everything shut down. And flight attendants were expected to go to work. And there were no mask mandate other than airline policies. There were no vaccinations. It's impossible to socially distance on an aircraft. Good luck with that. And so the federal government, after about 6 months in, July 2020, came out with a report to say, don't worry about it. It was the Department of Health and Human Services, I think it was the Center for Disease Control and Transportation Security Administration, the FAA was in there as well. And it was this report that talked about the importance of social distancing, the need to wear a mask, the need to sanitize surfaces. But the report didn't use the word shall once. There were no requirements. It was all, well, they should do this and they should do that. So, they claimed that the pandemic was now over, that travelers could come back, that aircraft are safest environment you could be in, other than a hospital. And which is also amusing because everybody's avoiding hospitals because nobody wants to get COVID, right? So, there was just a failure, in my opinion, of leadership to provide the necessary protections for flight attendants in particular, but also pilots and passengers.
And the stress on your membership must have been tremendous. That they were being told to go back to work. Really, you're on your own, it sounds like, without proper protection, even masks. I mean, it sounds bizarre.
Absolutely. It was a very strange and very stressful time. And you can appreciate, especially if you're someone who has small children at home, or if your spouse is immunocompromised, or if you're taking care of elderly parents. I mean, we would have reports from our flight attendant members who would suspect exposure to somebody on board, somebody who was coughing and sneezing and had all of the symptoms of COVID. And then they would have to pay their own hotel bill to stay over for a few days, before they would go home, because they couldn't have that on their conscience to go home potentially with COVID themselves and infect their family. And if you're a regional flight attendant, you're not making a lot of money in the first place. So to put that on top of people and expose them to, without necessary appropriate protections, it was very stressful.
And we're talking about the individual flight attendant being responsible for their own care if they
Mm.
got COVID,
in
protecting
in many
themselves and their
cases,
family.
yeah, that's right. And then the rules changed, and they were allowed to quarantine, and there were 14 days, and then the 14 was reduced to 10, and the 10 is now being reduced to 5 or 0 depending. And I mean, in fairness, now vaccines are widely available, and the airlines promote the vaccines to their credit. And they certainly have a higher rate of vaccination in their work groups than the general population. But particularly in the first year, there were no protections in place, and people were expected to report for work with very few protections.
And how many members of your union got infected? How many members died? Not only the first year, but throughout this pandemic.
Yeah, well, I know of at least 2 that have died. I mean, it's difficult to know in some cases, did they get COVID at work or did they get COVID somewhere else? But certainly 2 certainly died related to work exposure. Many people have got sick. I don't believe that there is a case count of illness because the airlines don't consistently share that information with our local unions. So at some airlines, they may share a monthly list, and at others, they refuse to. They cite HIPAA concerns.
So the
So
government hasn't required that this information be released to the union, at least the union that's representing the members, the
no, no,
workers.
not at all. No, no. And not all flight attendants are unionized. Most of them are. You may know that Delta flight attendants are not yet unionized, but most are, and the union does not have the right to access that information.
And one of the other issues you bring up in the article is aerosols,
Mm.
because there's whole debate about how this COVID would be transmitted and whether there would be aerosols and what that meant for the protection of the flight attendants, the pilots, and the passengers. What is
Mm.
the issue of aerosols in relationship to protection of your members?
Sure. So, I mean, early on, if you remember this, there was a lot of talk about contaminated surfaces, and everybody was talking about hand sanitizer and contactless lavatories and this sort of thing. But the science was clear that COVID was largely spread by the airborne route. And that involves either droplets, big particles that fall out of the air quickly because they're bigger, so they fall out of the air by gravity, and they're when somebody coughs or sneezes. And then there are the aerosols, which are the smaller, teeny tiny particles that I'm exhaling as I talk. And they are smaller and stay suspended in the air for longer and travel farther and stick around. And on aircraft, because the relative humidity is low, the air is dry. Anyone who's flown knows that. The issue is that the particles that people exhale, whether they're visible or not, desiccate, they dry out, and they break into smaller particles, or they can, and they stay suspended longer, and they also travel farther in the air. So the low humidity on aircraft is another reason, in addition to people are packed in and people don't consistently wear their masks, and there are lots of factors. But that dry air also contributes to onboard risk of disease transmission.
And there were a number of studies done, financed by Boeing, financed by the airline industry, which have suggested or said that basically airlines are even safer than any other place to be.
Sure, yeah, yeah. No conflict of interest there. Absolutely objective source. Yeah, you're absolutely right. I mean, Boeing came out and said being on an aircraft sitting next to someone is like being 6 feet away from them. Airbus came out and said 7 feet, might have been the other way around, but you get the idea. It's ridiculous. The United Airlines CEO was quoted in the media this week as saying that you can be, as a direct quote, that's why being on an airplane next to 2 people in a middle seat is the equivalent of being 15 feet away from someone in a building. Wow, I don't know where he came up with 15 feet. It's just saying words. The airlines of course, are motivated to get people back. And the aircraft manufacturers do not want to be blamed for this. And certainly, I mean, the design of the system is such that ventilation air comes in the top of the sidewall and is exhausted at the floor. And that's how it's supposed to work. Not too much back and forth flow, but there is back and forth flow. And contact tracing studies of um, COVID-19 and SARS, if you remember SARS, also a coronavirus 2003 pandemic, and others, flu, show that there's some forward and back movement of air. And the greatest risk is if someone sitting in your seat row is infected because of that side to side airflow. But there's also, the World Health Organization has said 2 rows forward, 2 rows back, and all flight attendants are contacts. And some studies have found as many as 7 rows away, because when that service card is pushed through the aisle, it entrains air. The dry little particles travel up and down. People get out of their seat, they talk. The system isn't perfect. So, and there's some sort of messy reality of being a bunch of human beings in a small enclosed space that puts people at higher risk. So this idea that, the aircraft is the safest place to be, it's just, well, I could think of all sorts of words, but it's untrue.
And there's no testing of passengers before they go in, whether or not they have a fever. I've traveled and had a cough, a cold. I tested myself before, so to find out if I had COVID or not. I wouldn't have traveled if I had, but there's no real requirement. It's kind of everybody's voluntary, whether or not is this a danger to the health of the public safety?
Oh, well, yeah, there's no requirement, and now there's no mask mandate. As of April 8th of this year, there's no requirement to wear masks. We've heard from our safety representatives that about, well, depending on the airline and the flight, 10%, 10 to 30% maybe of people continue to wear a mask. And so,
Could the
and
air
as you said,
could the airlines require that there be masks while you're on the plane?
well, they did for the first year. So from sort of February of March of 2020 until President Biden issued the executive order in January 2021. I think it was in a day of his, becoming president. He made that the priority, and then TSA, Transportation Security Administration, turned it into a rule that the airlines had to follow. But for the first while, it was just an airline policy to wear a mask. And as you said, there's no requirement for testing before you get on a plane, unless you were traveling internationally. And still, some countries have a requirement for testing before travel.
And there's a statement, the Confident Travel Initiative. Maybe you can talk about that.
Sure, yeah, the Confident Travel Initiatives at the Boeing one, yeah. So Boeing did some modeling, computational fluid dynamics, and they were the ones who came out and said that the design of the cabin and airflow system creates the equivalent of over 7 feet of physical distance between every passenger. I mean, that's just not true. Maybe under idealized conditions, the system works in such a way that there's minimal airflow back and forth. But even so, you cannot tell me if I'm sitting next to someone who has COVID that I'm not at increased risk, and that it's the same as if I'm 7 feet away. And there have been other studies. Harvard School of Public Health did a study that they referred to as independent, but it was funded by Airlines for America, Boeing, and airport operators. And they also said, well, our people tell us, the manufacturers tell us that this is how the system is, so it must be great. It's interesting. There's a lot of talk in the media, and people say this to me also, well, but the air is replaced every 2 or 3 minutes, so we're good, right? Like, that has to be good. And the issue is that when people there, that is good, but if you have a strong, what is called source strength, if you have a lot of people in that small space that are breathing out, then the concentration of gases and potentially particles that you exhale goes up. And the best way that I have to explain that is kids peeing in a pool. if you'll stick with me for a second on this, if you have water flowing into a big pool and a few kids are peeing in the pool, it's not going to be awful. So long as the rate of change of water is high and there aren't many kids, okay, not great, but okay. But if you have a very small pool, like a kiddie pool, which is like being on an aircraft because you don't have much dilution air assigned to each person, it's a very densely occupied space. So you've got a small kiddie pool and you've got a lot of kids peeing in the pool. Doesn't matter how quickly you replace that water going in and out, the concentration in the pool is still going to be higher. And it's the same thing on aircraft. The air does get replaced every few minutes. That's true. But because you have so many people and it's such a small dilution volume, the concentration still gets high.
And if you have underlying health issues,
Mhm.
if you're seniors and you are in a plane, then the danger of getting COVID and having your life maybe destroyed is a real problem. Who do you think should be responsible for that?
Well, it's a higher risk. I mean, if you're a senior and you wear an N95 mask and you keep your mask on rather than removing it, the risk is low. Um, Many people are vaccinated. I mean, there's like a calculated risk, I guess. Uh, I would say that if you wear a well-fitting face mask and you keep it on, the risk is low. So I'm not saying nobody should travel. I'm saying that the airlines should and aircraft manufacturers should be a little more candid about the shortcomings of the systems. And certainly for the people who are in that environment all the time, there need to be protections in place.
And what are the TSA loopholes?
The TSA loopholes for, well, so when TSA had a mask mandate, which ended in April of this year, they said, well, you have to wear a mask, but it's okay not to wear a mask if you're eating and drinking. Well, okay. So many people would comply with the spirit of that requirement and they would sort of dip and sip, they call it dipping your mask, taking a sip, putting your mask back on. And then some people who don't want to wear a mask in the first place will leave their mask off while they're eating and they will eat that pack of peanuts for 2 hours, right? So eating and drinking is one loophole. Obviously, there was talk of if you have an anxiety disorder or if you have a medical condition essentially that disallows you from wearing masks, then you can get a doctor's note, sort of there was talk of that in the or early on. Um, and some people have chosen to politicize wearing masks. That's no different in the airline industry than anywhere else.
And what do flight attendants think about this idea of freedom? Uh, the idea that you shouldn't wear a mask. I mean, in Asia, Japan, China, people wear masks, uh, regularly. I mean, it's not,
Sure,
and they
yeah.
don't die from the bad breath or from the bad air.
Right,
You know,
right.
it's
Well, I suppose my answer is that flight attendants would think the same as anybody else, right? That in my opinion, you have the freedom to make bad choices. I suppose you have the free, but it's unfair that you could have freedom to potentially infect someone else. When it's a question of um your personal safety and someone else's personal safety, then the community spirit should prevail. You're all in that aircraft together. And, we see this outside of airplanes as well. I believe in wearing a mask. You might not, but if I'm sitting next to you, particularly if there's a mask mandate, I expect you to wear a mask, whatever you might think about it. And that's just a common courtesy that is especially important if people are required to be in that environment if they're going to get paid.
and OSHA is supposed to be responsible for protecting the health and safety of workers. What has
Mhm.
been the role of OSHA of enforcing health and safety rules in the airline industry? Have they defended your members? Have they been involved in
No,
making
no.
sure that the rules are enforced?
No, very, very minimal. So, I mean, on COVID specifically, OSHA issued an emergency temporary standard, which was then the I think it was federal court ruling said, no, you can't do this. You don't have the authority over anybody except for maybe healthcare workers to require masks and everything else. Um, in the bigger picture, the Occupational Safety and Health Act was passed in 1970. and it's supposed to cover safety and health protections at work for most Americans. And then in 19, but there's a clause in the act, and it says, well, but if another federal agency comes along, they get it. So in 1975, the FAA came along and said, we're the other federal agency, we're the experts in aviation, we're going to do this. But they didn't do it. They didn't do anything at all for crew member safety and health. And my union, AFA, started a big campaign around 2000 called the OSHA Now campaign. We had other campaigns before this, but we ramped up our efforts then and pushed for OSHA protections for flight attendants. Pilots said, we don't want OSHA in our workplace. Pilot union said, we don't want OSHA. We will stick with the FAA. Flight attendants said, we want OSHA. FAA's done nothing. And as a result of very long, hard fight, there are now a handful of OSHA standards that apply to flight attendants. Bloodborne pathogens, noise, a few others. But generally, OSHA doesn't have jurisdiction in the aircraft cabin, and certainly not when the aircraft is, wheels up in the air.
And there are only 1,000 OSHA federal inspectors in the United States for 330 million people for millions of workers. So the chance of even having an inspection is highly unlikely. Workers have died at meat processing plants without OSHA inspections around the country. So workers are not really getting the health and safety protection they should be under the law, apparently, and that's a concern for workers around the United States.
That's absolutely true. Yeah, flight attendants are not alone in the challenges that they've had staying safe during the pandemic or any time. But if we just talk about the pandemic, healthcare workers, meatpacking plant workers, grocery workers, there are so many people who have had to face that decision. Do I go to work and get paid and risk getting a disease that could kill me or make me very sick, or do I, or not? I mean, that's just an unfair decision to make someone make.
And was there a requirement that PPE be required to be provided to all flight attendants?
Let me think about that for a second. Airlines generally provided a face mask, not necessarily a great face mask. Some airlines said you can't wear an N95 mask, and the feeling at the time was perhaps it looks too clinical and it could scare passengers, but also there was a limited supply, and it was felt that that's for the healthcare workers, not for you. Um, so it varies by airline to airline. Even now, many airlines continue to provide masks, even KN95 masks, to any flight attendant who wants them. And then some airlines will only provide a cloth mask with their airline name across the front of it. So it just varies. Yeah.
And the issue of health and safety protection for flight attendants with alcohol, the use of alcohol, flight attendants being brutalized, being attacked, spit on, physically assaulted. I mean, this is pretty traumatic treatment for flight attendants. What is it like for flight attendants, their health and safety, their mental conditions when they're threatened with being attacked and screamed at, and they're supposed to enforce the rules when there were rules?
Absolutely. So stressful. I remember one of our safety representatives said to me recently, we're not worried about getting COVID anymore. We're worried about getting beaten up at work. I get goosebumps saying that. I think it's heartbreaking and unnecessary. There is just less civility. Somebody described it to me recently as a general amped up attitude that people have about, don't tell me what to do. I don't care if you're the flight attendant, don't tell me what to do. And expanding alcohol service at the airports has made that worse, I would say. If you've been to an airport recently, there are signs all over it. Hey, buy one, get one free. We will deliver the margarita to your gate. Take one to go, alcohol to go, fly to. There's so many bulletins and advertisements for alcohol in the airports because the airport vendors have lost a lot of money during this pandemic and they want to regain some of it. And the best way to regain revenue for a restaurant is booze. Yeah, but that's a problem because then people either have a few drinks before they get on the plane or they bring a drink on the plane, not supposed to. But if you have a margarita in your to-go cup, I might think it's just an iced tea. I mean, whatever. It's not. There are no rules about the alcohol can only be served in certain containers that are easily identifiable. And even if they were, I could tip it into my coffee cup, right? So it's that, and then alcohol service on board also for airlines to recoup lost revenue. And when you drink a lot, most people get a little more entitled, a little more bold, and louder.
And what has this done for working in the airline industry for flight attendants? It seems like it's a job now that has stress and has real dangers to your health and safety, and even your ability to function. I mean, if you're worried about being attacked, physically attacked, your pay hasn't gone up appreciably
No,
as
no,
a
it hasn't.
police officer or anything like that. I mean, in
Yeah.
other words, you're in jeopardy.
Well, you're right. I mean, it's certainly more stressful. I have been on staff with the Flight Attendant Union for this is my 23rd year, and I could count on one hand the number of flight attendants I've met who don't like their job. I mean, people go into this job because they love it. They love flying. They love the culture. They love flying. They're good with people. They're problem solving, energetic, great workforce to represent. I love representing flight attendants. And yet their job is very stressful. And on top of all the other stresses of being away from home and long shifts and all the rest of it, the aggressive passenger issue continues to be a real problem. And people thought, oh, well, when the mask mandate goes, people are going to chill out. And they haven't. I thought that, and maybe the numbers will come down. Um, but there is still a significant issue with aggressive people on the planes. And part of that is a failure to um, enforce a level of behavior. FAA has what they call a zero tolerance policy for not complying with the instructions of a crew member. But boy, a lot of people are not complying, and they're not getting enforcement action, or they're not getting, investigated. It's being challenging to get a law enforcement officer to meet an aircraft consistently at the gate. And if the flight lands and the passenger who's being a jerk or violent or abusive or whatever else, there's no law enforcement officer there. Customer service agents can't detain that person, and so they just go. There's not a lot of disincentive.
And we talk about zero uh, tolerance, but also there's the issue of zero COVID in China and other countries. It seems like they take protecting passengers a lot more seriously than the United States. You think the attitude of corporations and the government is basically just have to accept it and live with it?
Yeah, I think that is probably partly resources, right? Like if you have a plane landing in a small airport with a small community at 11 o'clock at night, maybe there's no one there. So they need more funding to have sufficient staff to meet the aircraft. They need to provide pay protection if the crew members need to stick around afterwards and they're going to miss their next flight. They are trying to keep the industry going, which is good, but it needs to be kept going in a way that makes everybody feel safe. The aggressive passenger issue is obviously particularly unpleasant for flight attendants and pilots because they are in charge and it is their job to respond to it in a way. But it's also got to be really unpleasant for the rest of the passengers. So it seems like a win-win situation to provide more resources to manage that more effectively, to discourage that type of behavior.
Well, if your union AFA was in charge
Mm.
of the airline industry, what would your agenda be for protecting your members and the public?
Yeah, well, we would want more funding to get law enforcement officers reliably to meet a gate. Would want to have threat reporting to be mandatory, not sort of loose. Well, flight attendant reports the pilot. Maybe the pilot will call ahead. Maybe they won't. It should be required. There should be a travel ban for people who act badly and is documented and shown to act badly. They shouldn't be allowed to fly, whether it's for 6 months or a year or however long, depending on the nature of the issue. And there is a bill going through Congress now, bipartisan bill, that would be intended to have a no-fly list for people who behave badly on aircraft, essentially. But that all of those would be important, and also tamp down the alcohol to go offerings at the airports, and limit alcohol service on board. No issue with alcohol outside of the airport environment, but making alcohol, sort of promoting it to a group of people that are in an enclosed space when emotions seem to be running higher than usual is a bad idea.
And reporting about if people get sick, or testing of people, so that if somebody for example, went on a flight, they had COVID, they knew they had COVID and were coughing during that flight, it seems that there's no tracking. Is there tracking of passengers and staff from these flights, who has COVID, who doesn't have COVID, and transmission? It seems like the airline should be responsible. You're going on a plane which they say is safe.
Yeah, I agree with you. And there used to be, and now that people are sort of pandemic fatigue, and surely it's over by now, that there isn't that tracking anymore, at least not that I'm aware of. Whether or not the CDC and public health departments continue to do some contact tracing, I don't know. But certainly that would be a good thing. The vaccinations, crews should get priority, and obviously now there's an abundant supply of vaccinations, but at the beginning there wasn't. Masks, at a minimum, if masks aren't going to be required, then flight attendants, crews should have the right to wear a mask without fear of any kind of discipline, or feeling like I'm a bad flight attendant because I'm not showing you my smile. And airlines, to their credit, have continued to openly allow, if you like, flight attendants to wear a mask if they want to. And I would hope that that would continue, because at the beginning of the pandemic, airlines didn't want flight attendants to wear a mask because it didn't look good. And that there's a long history of flight attendants need to look a certain way. I mean, the weight restrictions didn't get dropped until the mid 90s in the United States. You had to weigh in before you report for work. Further back in time, if you're a flight attendant, you get married, you're fired, and so on and so on. You have to look a certain way. Even now, there are look books, as they call them, like appearance sort of standards. You're only allowed to wear a certain type of jewelry. Or my favorite one was, I read recently in one of the airline lookbooks, that you have to have a full frontal complement of teeth to work as a flight attendant. So, the standards have changed over time. You no longer need to get weighed, but you do have to have your teeth, which is, I suppose, fair enough.
And also your union is engaged in an effort to organize a Delta, and is one of the issues health and safety and protection of workers
Yeah,
in Delta?
definitely. I always feel that, when flight attendants contact me and they have chemical exposure at work, or a question, an issue with COVID, I'm really glad that I can provide them with the information and access to, proposed services. So and I just feel like flight attendants need a union. Flight attendants really need a union, and safety and health is an important component of that. So I would be delighted to welcome Delta flight attendants into our union and provide them with that same, support and information, and just another party who is on their team.
So a union means that you are going to have more health and safety protection in the airline industry if you're a member of the AFA,
yes,
versus
absolutely.
being unorganized
Yeah,
and
yeah,
on your own.
Yeah, I think, and if I get a call from a flight attendant who is, a Delta flight attendant, or someone who is either not unionized or with a different union, I will still help them, because to me, that's the union spirit of, we are all in this together. There is a sense of solidarity with people who work in this industry. But of course, yeah, I believe that the union clearly provides an important service to workers.
Okay, well, I want to thank you very much for joining us. We've been talking with Judith Anderson. She's with the Airline Flight Association, an industrial hygienist, and has written a document about some of the lessons learned of the struggle to protect the passengers and the flight attendants with COVID-19. So thanks for joining us.
Thank you so much. Thank you. I enjoyed it.